You're watching Caribbean Today on YouTube. The Trump administration is demanding that Caribbean nations stop employing Cuban doctors, warning that officials facilitating these missions could face visa restrictions. Secretary of State Marco Rubio argues that Cuba exploits its healthcare workers through forced labor and has deemed it as human trafficking. The policy aims to reduce Caribbean reliance on Cuba's state-run medical system and align these nations more closely with U.S. interests. Many Caribbean countries rely on Cuban doctors, nurses, and biomedical engineers who have historically played a critical role in providing essential healthcare services. Leaders across the Caribbean are concerned that the new policy could severely impact public health overall, particularly in small island nations. Jamaica's healthcare system is underfunded and overcrowded, and there's a shortage of medical professionals, with many doctors migrating abroad for better opportunities. Without Cuban doctors, Jamaica's healthcare system would struggle to survive. Foreign Minister Kamina Johnson-Smith acknowledged the importance of the Cuban medical personnel, emphasizing that their presence is vital to the healthcare system in Jamaica. The threat of revoking visas for government officials hiring Cuban doctors and nurses would also affect their families on visas in U.S. schools. The prime ministers of Trinidad and Tobago and St. Vincent and the Grenadines said they would rather forego their U.S. visas than to have poor and working people die due to lack of medical care. Barbados Prime Minister Mia Mottley, in defending Cuban medical personnel, stated that Barbados could not have gone through the COVID pandemic without them. She added that if a sensible agreement cannot be reached and losing her U.S. visa is the cost, then so be it. Some governments are weighing their options, balancing U.S. relations while trying to maintain adequate healthcare services for their populations. The U.S., however, sees the deployment of Cuban doctors as a means for Cuba to exert their influence over other nations and is determined to put an end to it. The administration has made it clear if Caribbean nations continue to employ Cuban healthcare workers, they will face economic sanctions and visa restrictions. Trump has insisted on discontinuing the use of Cuban medical professionals in favor of hiring doctors from India, the Philippines, or Africa. At CaribbeanToday.com, we cover your world.